Hi, this is Dr. Ken Richter, and welcome to the SFM DPC Chronicles. Today's episode is going to be The Cost That Kills. I started my day as I normally do, seeing some patients, and I was greeted by a new patient named Edward. Edward was relating that he had had a past history of what is called an abdominal aortic aneurysm. An aneurysm is a swelling of the aorta that can be very lethal if the aorta gets greater than 5 centimeters in diameter. If the aorta enlarges to a critical point, then it can rupture. There is a surgical treatment that can repair this enlargement before the rupture. I asked Edward when he last had a CAT scan of his abdomen, and he told me it was about 4 years ago. I asked him why he did not go on the recommendations to recheck that aorta. He told me that he was still paying back the $2,000 that was charged to him by the insurance refusing to pay for his CAT scan. Because of direct primary care and the relationships that we form with imaging companies, I was able to get him a CAT scan of his abdomen for $200. Edward went to have his CAT scan, and it was found his aortic aneurysm was now 5.4 centimeters in diameter. It was recommended that Edward go for immediate surgical consultation, and indeed, surgery was performed, and the risk was removed from his aorta rupturing. Edward was thankful that we were able to get his CAT scan for a reasonable price, and equally angry that he was charged 10 times that amount for the same procedure 4 years ago by a hospital system that was overcharging the patient because of his insurance coverage. When Edward realized his risk, he told me how sad this is, that his life was put at risk because of someone else's greed. He said, "Direct primary care not only saved me money, but it saved my life." Direct primary care, making care accessible by making it affordable.